Thank you.
Now it's the turn of our chief instructor, Dr. Sony George. He doesn't need any introduction. He is the head of the Vasan groups in Kerala branch, and he'll be talking about the perfecting IOL selection for optimal patient satisfaction. Over to you, Dr. Sony.
Thank you, Dr. Rohit, for the introduction. And now, earlier we had a situation where you could offer the patient a couple of lenses and Indian, foreign, foldable, etc., etc. But we never used to really worry about what is the span of vision, what the patient really needs. But the times have gone, and cataract surgery is becoming a refractive surgery. And now we see, even after the age of, this is data from 2010, even above 65, 53.1% use internet and 14.5 use smartphones. And the working distance on various gadgetry, we need intermediate vision is also as important. So, coming to the material, I don't think we should emphasize any more because hydrophobic acrylic is the lens of choice, and with the Indian companies coming, it's become very affordable. So the consideration about selection of an IOL, one is the economics. After all the good work done by the during the FACO and all the other steps, it should be helping the selection of the IOL, and it should help the IOL should help improve the vision to the best extent. So economics is one criteria. Like I said, now Indian companies have come with good IOLs. Photic phenomena is very important. You have to look at the profile of the patient, what kind of work they do. Do they do a lot of driving, etc., etc. So astigmatism, nowadays, we always have to offer any patient with above 1 diopter of astigmatism, we should offer them a toric IOL. And functional working distance. Now this is new. Most of us do not read at the conventional 33 centimeters anymore. We usually, because we are used to gadgetry, mobiles, laptops, etc. Our new working distance around near vision is around, the newfound vision is around 40 to 45 centimeters. So that also decides in the lens selection. Like in economics, I said hydrophobic IOLs are plenty available from the Indian companies, and aspheric IOLs too. And multifocals also. There are many Indian companies which make good multifocals, like the few like Icral Active from Biotech and Define from Oro Lab. This give excellent vision. But then we have to prime the patient about the photic phenomena, etc. For the people who do not want that, we have the Indian EDOFs like the Swiss Phobe from Apasami, the Vivid from Oro Lab, which give pretty much good results and minimal photic phenomena. Looking at the photic phonomena, if that is the main criteria, lenses like VVT, the X EDOFs are one very good lenses which give the photic phenomena profile almost like a monofocal. You have the Geometric Plus from Hoya, which also is a trifocal, but with almost 10% loss of light. The AT Lara or the Panoptics and the AT Lis are the trifocals are still good with a loss of around 12 to 14% of light. The more the number of rings, the more photic phenomena. The more loss of light, the more photic phenomena. Astigmatism, it is imperative that any multifocal or any EDOF lens, you should have a toric version because it is unforgiving. Residual toricity is unforgiving. So functional working distance, again, you have the geometric plus, etc., which give you a very good vision at around 40-45 centimeters, the VVT 2, and the Swiss Phobe and the Vivid give. What you can do in these cases also, the patient wants photic phenomena free, glare free vision. You can always do a micro monovision in the non-dominant eye, and that will help him to recede the reading distance around 30 to 35 centimeters also. The only thing is you need good light, good ambient light, because the light is being split up. So going through a few of the lenses, one of the multifocal still available good lens is the AT Lisa. You have the AT Lisa Tri family. So you have a near rad of 3.3 and 1.66. Wonderful lens. Showing the video. Just to show that there's a not touch this one. This is the cartridge which comes in solution. You don't need to touch the lens alone at all. You can just place it, remove the cap, and then inject the IOL. And this is how the lens looks. Obviously, the rexus should be good. The overlap should be perfect so that the ELP is maintained. And the panoptics also, it's called the Enlightened technology, which are continuous range from 40 to 80. And this is how the lens is being injected. For want of time, so any toric multifocal, any multifocal or trifocal, you should go for the toric version. The Swiss Phobe is a low-cost Indian version. So this works by aspheric correction. So normally you do an aspheric correction around 0.2, minus 0.22, minus 0.27. Here the central area is aspherically, preferentially corrected so that you get a better depth of vision. And the periphery gives good far vision. And this is what it looks like. It works very well in 67% of my patients. It works well with 6.6 N10. Like I said, of course, I do a micro monovision correction and visual disturbance. And compared to Eyhance and Magnificent, it is much better. The Vivid is another one. It has got a central refractive zone and the peripheral diffractive zone, which accounts for the improvement in vision. Again, with a micro monovision correction, I can almost offer almost 70% patients with 6.6 N6. And the well-known, one of my favorites is the Acrosof Vivity, which has got two surfaces. The central area, the elevated platform around it is the one which stretches the light, and the central portion shifts the light, and this gives you a continuous range of vision. And this is how it looks like. And the halo profile is almost similar to a monofocal. Just showing the lens being centered. And this is just to show that it can be implanted in a rexus runout also very comfortably, owing, especially with the tackiness of the lens. And this is how the lens looks like in the post-operative period. Vivnex, geometric and geometric. See, it's got a truncated area in the center. And this area is responsible for the intermediate and near adhesion. And here the light is split. The geometric has more of far vision, and plus has more of near vision. Like at a 3 millimeter pupil, 21.8 of near and 50.8 in the geometric, and 32.8 in geometric plus, and 39 point in this thing. So comparatively, it's got a very good defocus curve. The injector system is fantastic. It's a no-touch loading system. This is the lens, and this is how post-operatively it appears. So now presbyopia correction and premium vision, range of vision can be offered to more patients irrespective of the financial status, level of activity, and astigmatism. Thank you very much.